Hi, everyone. Welcome to today's webinar. It's wonderful to be here with you on Thursday. We have over 500 people on the call today, and that's pretty exciting. Hope you're staying safe out there. These are unprecedented times, and I think that sometimes safety isn't just about what we do physically, it's also what we do emotionally. And I'm just so glad that you came on to this webinar. It is great for your mental health. It's great for your learning. It's great for thinking. We're going to get through this, and we're going to get through it together. So today's webinar, what does ending poverty mean in the face of COVID-19? And, you know, it's brought to you by Tamarac's Vibrant Communities, Cities Reducing Poverty, which is the network of 85 regions representing somewhere in the area of 350 municipalities. And all of these municipalities have poverty reduction strategies or are working on them. Give you a little context. We reduce poverty in Canada to the lowest level in history. And that was announced in January by our federal government. Our network was thrilled. You know, we were just over the top. We dropped it down to something like 8.7%. And in 2015, and this is like the end of 2018 stats, right? I'm sure it's even lower than that. It was lower than that. And prior, you know, in like 2015, we're at about 12.4. Remarkable. Really, really remarkable. I've never been prouder of our country than this. So here we are. We don't know anything. Like, all we know is that cities are rising to the challenge, helping people who are homeless, trying to figure out how to help people who are poor, neighbors reaching out to neighbors. As Jim will share later on and how he's inspired me, like, it's unprecedented, the kind of reaching out that's happened. Does that mean that people are still falling behind? Absolutely, they are. We want to talk about this, like, and today's webinar has almost nothing to do with answers. It's an exploration, and so your questions, you can either use the Q&A or you can use the chat box. Send us your questions. Tell us what you're thinking, what you're asking about reducing poverty. We've got with us two amazing people. First of all, one of my all-time favorites, Jim Hughes. He's McConnell Foundation's Executive Lead of Government and Partner Relations. Jim is a Foundation Senior Fellow. He works very closely with the president there, developing ideas and that type of thing. But, you know, I first heard about Jim when he was the Deputy Minister of Social Development in New Brunswick. Now, that's cool. Why? Because that province was the first province to launch a poverty reduction strategy. And I hope Jim talks about it somewhat, but it's an amazing one because it has lasted through like 3 or 4 governments. It is one of the most comprehensive in the country, one of the best thought through, and Jim was at the helm at the time. Now, he came to that job, honestly, because he was the Director General of the Old Brewery Mission in Montreal, where he, you know, worked with supporting people who were homeless and people who were really at high risk. Jim has 2 books, Early Intervention, that he published in 2015, and Beyond Shelters in 2018. Jim, welcome to this call. Can't think of a better person I want to talk to about this topic than you.
Paul, it's great to be here and share the stage, if you will, with you, talking about these issues in such unprecedented times. I'm just so much in agreement with what you said, that, you know, we're really at a state of asking questions because we just can't have all the answers. We're just so in the middle of this. But I hope there's going to be some value in this conversation to everybody on the call. So looking forward to it very much.
I know. And then Jim, you and we agreed we wanted to invite Alison to the call because Alison Homer, she is our fearless leader, team lead at Cities Reducing Poverty, has been with us for many years. Before that was part of the network at Vibrant Abbotsford. She and her team, Alison and her team, have been surveying all the members, asking them what's happening. What are they doing? What are their cities doing to reduce poverty or to support people who are living in poverty? And they're putting together this amazing guide that is going to be sent out to all the cities that shares kind of practices. What's everybody doing? And we're hoping it will fertilize new ideas and bring good high level support. So Alison, welcome here. Thanks for coming. Maybe we could just start with you, Alison, and Jim, jump in with any questions or sub questions. But give us a sense, Alison, what's happening out there amongst our cities reducing poverty. We're in almost every city in Canada. I think 98% of people living in poverty live in the cities that work in, that are part of the network. What are you hearing?
Thanks so much, Paul. Yeah, it's been incredible over the last couple of weeks. Our teams checked in with our 81 members from across the country. We've been offering support and also asked them to share some of these stories of innovation and resilience. So happy to share some of those with you today. I'm based out in BC in Revelstoke, a little small city of around 8,000 people. I thought I'd start with just sharing what the responses looks like here in my community. So within Revelstoke, I guess first I could say Revelstoke supported the need for safe spaces for self-isolation. So the city's working with BC Housing to offer hotel rooms to healthcare workers that have family at home, to individuals experiencing homelessness or experiencing domestic violence and other vulnerable populations. And with the housing, they're also providing supports like grocery store and food hamper deliveries. Childcare facilities have been able to stay open for essential workers. And our local physicians are providing reliable health information to the community. Our BC Transit and Handy Dart services are now free. And the city has really taken a lead in providing supports and resources to small businesses. Community Futures is providing emergency business loans. They're suspending loan payments and helping the community to navigate support. Businesses are taking their services online and doing lots of delivery, as well as modifying their hours. So for example, seniors being able to access grocery stores for the first hour of their days. Monash Spirits in town was actually one of the first distilleries in Canada to start producing and distributing hand sanitizer. And I know that's taken off across the country as well. Lots of supports around connecting seniors and others that are isolated and to address emerging mental and emotional health issues. We have lots of hearts popping up in windows.
Yeah, Alison, these are amazing stories. It's interesting that you share them because you're really describing what's happening in almost every community in Canada. We are so fortunate here that there is a sense of really strong civic engagement, and we have an incredibly important social safety net here and not-for-profit. What's happening across the country? What have you guys been seeing across the country? What are some of the exciting things that are happening? What would you say is changing?
So some of the big themes that we're seeing, so of course, communities are shifting from focusing on supporting residents to thrive to supporting residents to survive, at least in the short term. Lots of coordination of services and leveraging of online platforms, so resources like helpseeker.org, communities are making sure that those databases are up to date, so we know what's close, what's open, creating interactive food directories, what food supports are available. I think one of the important things that we're seeing is support to help people who weren't able to file 2018 taxes, to keep the volunteer income tax programs open, to bring those programs online, and to support people to know what benefits are available to them and how to access them.
That's excellent. Like, I think these are really important themes, and jump in, Jim, you know, like moving from survive from thrive. I have seen remarkable supports being brought up, including, the town of Vancouver, the city of Vancouver, converting entire hotels. Kitchener did this as well, into shelters so that homeless people can self-isolate. It feels strong. I wonder where the gaps are. I don't know if you've heard anything. Our federal government has been amazing by doing some top up. I know that there are areas that we're still challenged by with low welfare rates. It's hard for people to self-isolate like this. But then for people who even have lost jobs and don't qualify for unemployment insurance, we've essentially implemented a guaranteed annual income of $2,000 a month. That's pretty amazing, huh? More thoughts, Alison, on just sort of the macro things that you're seeing happen? What are some of the challenges that communities are facing?
I would say one immediate response. There's been a lot of need to support food security initiatives. We've seen the need for food supports, more than double, at least here in Revelstoke and across the country over the last month. So a lot of focus on keeping those food services open. Here it's been leveraging connecting the local food bank and food recovery programs, but also making sure, farmers markets, community gardens are seen as essential services. There's lots of education, seed sharing, community gardening, support for school breakfast and lunch programs. So I think food security has been well supported, but also one of the major needs at this time.
Alison, maybe I just jump in and
surviving.
Yeah.
Sorry, Jim, jump in.
Yeah, thanks. I'm just wondering what you're hearing on the ground on the as regards seniors. It's here in Quebec, where I'm from. It's becoming the issue. That is how we're caring for seniors who are isolated, scared, and in many cases in congregate facilities where they can't socially distance and they can't receive families in to provide the kind of emotional support that Paul was talking about off the top. What are you hearing about that?
Now, there's been quite a few of our members are convened by United Ways. I know United Way in particular has done a really great job with supporting seniors locally. A lot of local social media, Facebook type coordination of efforts that connect people with each other, connect volunteers with those who are in need. So, for seniors that require grocery deliveries, somebody might be able to go pick them up. And in terms of the isolation, little things like we see kids playing tic-tac-toe with seniors outside of the windows of their residential care facilities. And also we have a seniors phone chain here in Revelstoke, where you have, you're responsible to phone someone else on the list, and that chain will continue so that people are connected.
Fantastic. I'm going to move over to asking Jim some questions. Huge thanks, Alison. We'll come back to you later. And Jacob, Brian, Kate, Lucy, Suzette, Catherine, all of you have questions, and there are more people in the chat room. We've got Anne and Kimberly and Mary all asking questions, so they're piling up here. But Jim, if you can all wait a little bit, let's talk to Jim quickly. and well, not even so quickly, but for the next 15 or so minutes, and then we'll come to your questions. Jim, you are one of the most experienced people on this file. You know so much about what's happening in cities and provinces. You've implemented one of Canada's top provincial poverty reduction strategies. What does COVID-19 reveal about the Canadian social safety net?
Thanks, Paul. I've been thinking about this a lot. We all have. And I think there's a lot of good news in what we're living through. The Canadian social safety net is, of course, a bundle of rules and regulations and programs and funding and federal provincial transfer agreements and so much more. But it really ultimately has two parts. It has two halves, the emergency intervention part and the early intervention part. The first, of course, is about saving life and limb. It's about intervening when someone has a crisis that needs to be addressed. And the emergency intervention apparatus that the governments across the country have set up have been remarkable. There's gaps. There's absolutely gaps. We mentioned the seniors file in the long-term care homes. That's a gap. But to a large extent, when political will became clear, our health systems, to start with, put in place the kinds of measures, testing to the extent testing kits were available, procedures and protocols within hospitals, ICU beds. They turned a switch and demonstrated again that in terms of emergency intervention, there's almost no country better on earth than ours. So emergency intervention is not just restricted to health, it's also as regards financial and income security programs. The Canadian Emergency Response Benefit has been rolled out at lightning speed, and the government should be absolutely congratulated for that emergency response. And there's been many others as well, and we mentioned funding for food security programs, expansion of homeless shelter capacity that's been driven by government right across the country. So the emergency response has been amazing, but it's the emergency response itself is not the reason we're going to be having too many deaths, but not millions of deaths in terms of this pandemic versus previous pandemics. The reason that we are going to limit the spread of the virus and the extent of the mortality is because of the early intervention programs, the other half of the social safety net. And what is that? I mean, of course, it's the physical distancing that we're all practicing that's been put into place by government. It's the contact tracing that has been going on intensively to find people who have been in touch with people who've been found to be positive and telling them to self-quarantine and get tested. It's all the private sector types of prevention that we're putting into place, from the 2-meter rule when we go outside, to ensuring when you go into an essential service that there's plasticized barrier between you and the worker. It's
and Jim, you know,
remarkable what we've done on that front.
Yeah, all of these things are absolutely remarkable, and in a sense, they are relevant whether you're rich or poor. It's across the board. And when you actually think about poverty, what's some of the fragility of the system that maybe we didn't know about, or are we seeing some sort of fractiousness in, that's not even a word, in the Canadian economy? You know, I know we're doing all these things right, but what's not right? Because I mean, poverty itself isn't right.
Right. Well, exactly. So as I say, the good news is that we've put into place emergency and early intervention systems that are going to limit the damage. Okay. What that shows is that we can intervene early, and maybe this is another conversation we'll have later on. But ultimately, we don't intervene early in almost any other way in terms of people with, you know, in child protection, in autism, in children with disabilities, and so on. But it's a big reveal about the system that we can intervene early. But and that's sort of the good news, is that we can do it. The bad news is that those who are worse off are worse off. So those who are already at the fringe, food insecure, those people who are living in homelessness, who cannot physically distance. We all have these stories about what the homeless shelters are trying to do, head to toe sleeping, half the number of people in the dining rooms to ensure some distancing. But you just can't, if you're homeless, you can't survive this crisis easily. One of the shelters here has got 5 COVID patients that they're trying to manage. Where do you put them? So the answer to those questions, and there's so many more populations that are also very fragile, seniors who are in long-term care homes, highly vulnerable, because that's an environment where staff are, certainly here in Quebec, we're seeing underpaid, undertrained. And many of them are just ill-equipped to help, and many of them are not even showing up for work. So it's a very, very dangerous situation. There's other even more vulnerable populations as well. But just around the circle, Paul, if we had intervened early in those areas, if we had housed homeless people, if we had properly trained and paid workers at long-term care homes, as examples only, we would not be having those problems today regarding the pandemic. And so it's interesting that by failing to have intervened earlier on, we're now paying the price today.
It's amazing, Jim. I'm gonna ask you more questions, and particularly I'm going to give some time at the end of this conversation for you to talk about the path forward, the one that we talked about at Cities Reducing Poverty back in October. But Jim, I already have 27 questions waiting for us. So I'm going to jump into some of these, okay?
Sounds
and
great.
We'll give some time for the bigger stuff a little later on. But let's get into some of these questions. Lynn Smith asks, right now, it is great that governments of all levels are pitching in to help people from a wide variety of sectors. It's truly amazing. I wonder how we can encourage this type of thinking and these types of programs to continue in some way. It is a great time to push for minimum wage increases, decent job promotion, as most essential workers are the poorest paid with the least job protection and or benefits. Brian Smith writes, what is the role of not-for-profits in responding to COVID? Kate Gunn writes, in the rush to normal, we need to use the time to consider which parts of normal are worth rushing to. How best can Cities Reducing Poverty together bring a voice and mobilize support more broadly for those things we know need to be the new normal built on post-COVID-19? Jim, your thoughts on that? Like, what's the role of, how do we make how do we make things better, right, from this response? That's really what they're asking. And it's like, do we go back? Do we snap back? Right? Do we snap back? Do we create a new equilibrium? Right? Or are we needing to respond to constant crisis? And I'm wondering if there's going to be a bit of each of those. But
yep.
You get the sentiment. A lot of the questions are in this vein. Can we make things better?
So yeah, this is it is a great question. Thanks everybody for that, and let's think about that together. I think there's a twin response, and I think you're implying that, Paul. I think the first is the hopeful response. The first is look what we can do together. Look what we can do to help the most disadvantaged in our society. Look how we can reach out and put our arms around our neighbors in a way we might not have otherwise been able to. Look at the power of government to do good when it needs to. So yes, to the question about should minimum wages be increased, should we consider, like Spain, a basic income for everyone, the CERB being in many ways the level of basic income that we would like to have, not welfare payments, which are way below the poverty line, in many cases below half of the poverty line. And I think those are, we can hope that there's momentum to do that. These measures have all been framed as temporary measures, including the wage subsidy, that we can get into if people want to. But ultimately, the other half of this is the danger of what we've seen in the past, is that when governments are crippled with debt, when economies are not strong enough to produce the kind of tax revenue and jobs that we've seen during higher economic output periods, we know austerity follows. We've seen an expansion of the social safety net in the 60s and 70s, and then it being pulled back in the 80s, 90s, and early 2000s, and then expanded again, especially in the last few years with the Canada Child Benefit and other measures for seniors and others. But are we in danger because of what we see coming? We can massive government deficits at the federal and provincial level, economic activity that is being reduced daily, a 9% reduction already since the start of COVID. And will we see governments start to shrink their investments? That would be predictable based on historical performance. So what do we have to do to make sure it's more the former than the latter? I think we've got to think about the issues of fairness. I think fairness is the language that may guide us forward, because it would be unfair to recover from this and as Paul said, snap back to normal and leave in place the kind of fragility that now we know that is in place. We know, we've seen it. We've seen it with our own eyes. What happens when we leave people like homeless people, food insecure people, seniors in such a vulnerable place, and others. We have to deal with that now. And not only because it's fair, and I think fairness, as I say, is the watchword, because it's actually smart. Because folks, this will not be the last pandemic, the last disaster, the last crisis we face. And to be ready for whatever comes next, we have to do that early intervention piece that I talked about off the top. That's my hope.
Fascinating, Jim. It's really, you know, it's really sort of looking at how we do this. And I'm just going through a lot of the questions here, and a lot of them are on this vein. We're now up at 40 questions, so I'm scrolling through them. Sorry, everyone. Trying to get ones that are a little bit different than looking at what Jim just talked about.
Paul, while you're doing that, let me just say something about the nonprofit sector.
Go for it.
Yeah, so the nonprofit, I mean, so I work for the McConnell Foundation. The nonprofit sector is our sweet spot in terms of our granting. And I've obviously, like so many on the call, have been involved in the nonprofit sector for a long time. And, you know, so I'm just so thankful, so grateful about that we have one that is so strong, so resilient, and so innovative. It's stretching and changing its business models to be able to support the people that are within its networks. But they themselves, those organizations, so many of them themselves are starting to face two very serious problems. The first, of course, is volunteers. They can't get volunteers in because of COVID to help them offer the kinds of services they have in the past and to the extent they've been able to. And two, financial resources. So forget it if you're a nonprofit organization trying to organize an event, a fundraiser. You can't do it. So in terms of private revenue for nonprofits, they're down. So volunteer resources down, financial resources down. And yet the demand for those services, especially essential services, is up. What is the program we're trying to put in place for nonprofit organizations to be able to also face the crisis and emerge from the crisis stronger? I think it's one of the really big questions we haven't answered yet. The wage subsidy program that the federal government has put into place is available for nonprofit organizations. I don't know those details as well as I'd like because it's still being thought through. But I'm encouraging all nonprofit organizations to take advantage of the Canadian Wage Subsidy Program so that they can continue to offer services to the extent possible.
Jim, I know we're going to come to this a little later on, but we've got a whole series of questions here about the guaranteed annual income. Dia Maatis, I'm sorry, I can't pronounce the last name. I haven't heard much discussion of guaranteed annual income as an income security measure within the COVID context. I don't know much about how it would be administered, but would a guaranteed annual income have prevented the need of these emergency response measures? Interesting. Brian Smith, is basic income something we should all be advocating since the federal government seems to have adopted it as an interim measure? Were you surprised, Jim, by that $2,000, kind of like, you don't qualify for all the other stuff we do, it, here's $2,000 a month for you? Were you surprised by that? And does it smell like a guaranteed annual income?
Yeah, it does. I think it's great policy. They got it up. CRA got it up lightning fast. And it does feel like it. There are some qualification issues. It isn't actually available for everyone. You have to have certain minimum employment or self-employment income to be eligible. There's also a maximum as well. So at the end of the day, this is a great program. But it's being put up so fast. Absolutely, there'll be some necessary tinkering to get it better, and I know the government's talking about that and thinking about that, which is great. But I've read a lot of stuff about whether or not we are demonstrating the value of basic income, and I frankly think we are. We're showing the need for it. We're showing the power of it. And the social acceptability of it. And I frankly think it's time to consider it absolutely as a permanent measure. I think it's through that lens of fairness as well. It's the kind of program, if properly constructed, can top up other forms of revenue to make sure everyone has received what would be a minimum amount to survive with dignity, live with dignity in our society today. And that's the kind of model that I absolutely support, and I think most Canadians do as well. So I think we'll need to do a lot of research and a lot of study and a lot of engagement around a certain model. But have we shown that the principle is absolutely the right one? I think we have, and I think it'll be one of the silver linings to COVID. If it turns out to be the case.
Now that's the kind of optimism that I'm pretty excited to hear about, Jim. You know, I don't know. You know, I'm really hopeful. I mean, I kind of think, okay, what's next, huh? And you know, it's like getting back to normal. Well, you know, for people living in poverty, normal wasn't all that good. So do we want to go back to normal when it comes to ending poverty in Canada? Well, on the other hand, we've reduced poverty by over 1 million people. We've ended poverty for over 1 million people in the last 4 years. That's pretty significant.
It's very significant, but remember who we have done that for. We've done that for two categories of families, basically those with children and then seniors. Those are the ones that have been toppling the most. And we've got to turn our attention to unattached adults. It's the biggest category of people who are still living below the poverty line. And the CERB, or a basic income, is the perfect tool to address that last group. And it would only be fair to do so because these other demographic groups have been dealt with in ineffectively the same way. So I think if we come at this from the point of view of equity, I think we can look across the political lines. I know we all know the great Hughes has been talking about these issues for a long time. He was actually on a webinar this morning reinforcing this absolutely same point that COVID has showing us the value of a basic income, and the time is now to institute it in a sensible way, between federal and provincial governments. This should be a federal provincial program. The provincial government already offers its legacy welfare programs, which are so poorly constructed, that are so paternalistic. It's time to take the big brush and swipe those away and institute with those same dollars and a federal contribution, the basic income that I think most Canadians want.
Thanks so much, Jim. You know, we're already at nearing 40 plus questions here, and I'm some of them are just comments. So, you know, please, if you're watching us online, go into the Q&A, go into the chat box. Lots of great comments there. Rebecca states, our grandkids will pay the price for the federal help today. How can the rich be brought in to share the wealth they are sitting on? Will taxes change as we go forward? Will people have to pay more in order to afford all of this, particularly those who are making more? That's a fair question, and I think the answer of yes is fair. What data could be used to help tell the story to make the fragility and the inequity in the system real to people? What is being collected that could be helpful to demonstrate the need and to help continue to move forward? Lisa Petch. And Burrell, I'd love to talk about how we support continuation of some of the innovative collaborative initiatives we are seeing in our communities to support vulnerable populations as a critical response to preventing snapback. You're singing our song, Anne. That's what Tamarac's all about. And how do we keep doing that together? You know, Kate Gunn with another amazing post here. Canadian urbanist, aren't we all? Brent Toterin just posted a Twitter survey asking, what is key issue post-COVID for cities? 49% so far chose social equity issues, with transit at 21% and local business 25%. It's just a quick poll, but reflects what other people concerned about the future of cities and communities are thinking. This is an opportunity and a time to bridge sectors around this issue of poverty and equity, perhaps. Interesting, Jim. Public support, 49%. Where does this go, Jim? Where do we see the public going with this? How do we a lot of questions about how do we keep things going? How do we build momentum? What's going to be the public response? Are we going to get afraid of the debt? Are we going to rise to the need to build a more equitable society? You know, what are the priorities going to look like?
Yeah, those are the questions. None of us have that crystal ball, Paul, but we do know a couple of things. We know that politicians will be listening very hard, very, very hard to what is being said on the ground, what is being said by community organizations, what is being said by voters in every form that they take. Politicians, generally speaking, in Canada are like to follow, like to get in front of parades that are already underway. They don't like to lead them. They don't like to put their chin out. That's the historical record. So those movements that come out of COVID that are the strongest, that are the widest, the most evidence-based, will be the ones, I think, that ultimately will succeed in a post-COVID world, especially if they're driven by the Canadian values of fairness and equity and inclusion. That's a golden thread through our history, and it's not a straight thread. It's not a tight taut thread. It's a loose one, but it will come out. And so, you know, I think we're all hoping that things such as basic income, the reinforcement of existing social service programs through an early intervention lens, as I talked about, I think those are possible. but they're only become probable and likely if we organize around it in a vigorous way and frankly in a political way when it's time to be political, meaning obviously at election time, which is not going to be that far away. So, ultimately, I think we have a chance for progress on a progressive agenda in Canada because of COVID, but we equally have a chance of the reverse because of the debt and the deficits that we'll be incurring in the short term. Governments, quite rightly, by the way, have a responsibility to keep an eye on that and to manage our debt and our deficits in a responsible way. And so, can we do both those things? I say to you that we can. I say to you that we can afford a basic income, for instance, and we can afford a lot more programs. We haven't even talked about prescription drugs. And we've seen with the massive increase in employment insurance and the massive drop in people who now no longer have access to private pharmaceutical plans, private group insurance plans, that they have to pay for their own pharmaceuticals now. What a story, a fairness story for a national pharmacy plan, right? So anyway, there's so many components to this, but let's get organized, let's get muscular, and let's move the progressive agenda forward to the extent we can.
Brian Smith just said, thanks, Jim, for mentioning pharmacare. Lots of very interesting comments here today. I think the kind of interaction online, I'm listening to you, Jim, but I'm trying to keep up with all the conversations, and some of them are questions, but most of them are comments. And we've got a really engaged audience here. Jim, I said I'd give some time at the end here. You were very profound in October. We had a gathering of our cities. We all came together and we talked about our agenda for next year. And we said we were going to move this. We were going to move the dialogue from reducing poverty to ending it. And we said we were looking for pathways to end poverty. At no point did we think that COVID-19 would be our challenge. Just give us some insights around, because I think they're actually still quite relevant. Hannah has just put up our 5 strategies to end poverty here. Talk about these. You've already talked about a lot of the work on the offensive strategies. Are the defensive strategies seemingly being put into place as we speak to combat COVID?
Yeah, this is going to be tough stuff, right? Because of the distraction of the time. Just to say it, in terms of defensive strategies, there's only the 2: the indexation and the machinery. The boosting market wages and benefits would be more of an offensive strategy as well. But Quebec has just announced that it is increasing its minimum wage to $13.60. Notwithstanding COVID. So that's a beautiful sign that that those who are continuing to work need to be paid a fair wage to continue to do that, especially under these circumstances, right? Especially those those having to leave their house and go out and work, especially in essential services. But yeah, the defensive strategies, so indexation of current benefits. I mean, there's not many benefits that we actually index on a legal basis. And to do so, I think, is the kind of measure that locks in the gains that we have across our income security programs. The machinery, just for people who don't know what I mean by that, is those mechanisms that the federal, provincial, municipal, and other levels of government set up to bring in a level of accountability for progress on poverty reduction. And Paul's mentioned my time in New Brunswick. New Brunswick actually put into place the Economic and Social Inclusion Act. It created a Crown Corporation, the Economic and Social Inclusion Corporation, to oversee the implementation of the plan. That has a board made up of individuals from across numerous sectors, including people with lived experience in poverty. And it also set up machinery at the local level so that in 12 regions across the province, there'd be local poverty reduction plans that would hopefully work in a seamless way with the provincial plan. And that kind of machinery keeps a focus on, keeps a highlight and spotlight on the issue, and brings resources to bear to actually take it on. And we've seen the New Brunswick story is generally speaking a great one in a comparative way. The numbers in terms of reduction of poverty over the last 5 years have exceeded, I think, every other province in the country. And I think that is in part because they've locked into place this machinery that creates a level of accountability you wouldn't otherwise have. So I'm encouraging that. That's something that can be done in every place. My hat's always off to Tamarack in terms of machinery at the city level, where you put into place a whole different variety of kinds of committees and advisory groups, and in some cases actual municipal leadership in the area of poverty reduction. I think those are the kinds of things that we can do and should be doing. The offensive strategies that, moving us from where we were down even farther, I think a lot of those things, as we've talked about, are going to be under the microscope because of the financial pressure to reel back the gains, because we just can't afford to do otherwise. But I want us to encourage all of us to think with an abundance mindset and not a scarcity mindset as we start to think about ensuring everybody can be on the field of play in Canada. That's probably enough for the 5 strategies to end poverty, Paul.
Mm-hmm. Jim, the question, that's just brilliant. We're going to send out your paper to everyone after this call so that they can read it as well. And it's not specifically COVID related, but it's really important thinking in terms of how we start thinking about ending this. We have a question from Mary Pickering. Can we crystallize some key demands to insert into the federal recovery plan to help address the poverty issue in a system sense, the type of prevention strategy that Jim is mentioning? What are the top 5 key supports policies that could we be getting people back to work in new jobs, in seniors care, childcare, essential workers? And then I'm going to add to this, Mary, we've been getting a whole bunch of comments here about overpayments, right? So the government is going to sort of give the money now, ask questions later. What if you're in poverty, you got an overpayment and you can't pay it back, right? So these are other things. Like there's all these questions around the federal recovery plan. And I know I was on a call with Mary. She and Rick from Nelson pulled together a group to talk about the recovery plan. I'm just thinking of I'm just trying to sort of figure out how to survive in the current. And they're already talking about, okay, what's a recovery stimulus plan? What do you think, Jim? Where do we go with it? You know about this kind of stuff. You know a lot about government.
So I'm thinking it is a great question. People in the climate space are asking about this. Remember, recovery will mean that we move from response to rebuilding. And rebuilding, we have the precedent of the 2008 recovery, where the injection of federal stimulus into programs on the ground was massive. And much of it came in the form of housing and infrastructure. So we will probably see that again. So stimulating the economy, giving it that jolt to get back on its feet will come in part from a huge federal and provincial injection of cash. And on the climate side, they'll be asking in part for measures in that stimulus that are green. So if dollars go out the federal door for infrastructure and housing again, they better be green dollars. all kinds of conditionality around what those may be. And I think that's quite an interesting model to think about from a poverty perspective as well. So if the stimulus that goes out the door can be for childcare, for instance, I know there's a lot of talk about rebooting the economy by jacking up the provincial and capacity to deliver on-the-ground childcare. We're still so far behind in terms of access to affordable spaces in this country. Could that be a way, in terms of training new people, getting new people into childcare, making federal stimulus dollars actually conditional upon increasing the number of spaces? I think that's really clever and really creative thinking, and you can insert any other one of the social determinants for childcare and ask for conditionality in that regard too. So I think there's lots of exciting ways to do this. I'm a huge fan of public childcare. It's one of the best investments we can make for the economy. It's amazing for families and communities, and I think there's real genius in focusing on measures of that kind in the recovery plan.
Jim, thanks so much. You're a national treasure. You bring such wisdom, such amazing ideas, and such history to this. Let's get this back on track after COVID. Let's end poverty in Canada. Let's use this opportunity. I've got Natasha Pai in the background here helping me. She is with Cities Reducing Poverty, has been with us for many years now. And she wants to give the last voice, the last statement to Susan Fletcher. And Susan says, I disagree with fairness as the principle to move forward. We have used fairness and equity for years, and they don't matter to the right. Instead, let's think of what matters to them, effectiveness. We are seeing the ineffectiveness of the current welfare system. We are seeing the inadequacy of food banks in addressing food security. Let's propose effective strategies and show why they are effective. A great challenge, Susan. I think that resonates with all of us. I'm not sure we'll agree with you around the downside of the current system around food security, but we do know more needs to be done. And I've always been a believer that the more we invest in ending poverty, the better it is for all of us. It doesn't serve any of us to have people that are hungry. It doesn't serve any of us to have people who are sick. It doesn't serve any of us to have people on the streets who are homeless. And, if you want the best stimulus package of all, give more money to the poor because they spend it where they live. They spend all of it because they need to. That's the wisdom that I think we need to move forward. I'm hoping the kind of interest and the depth of questions go into the sidebars of this conversation we had today. Jim, Alison, you've really inspired people. Thanks so much, and wishing everyone a wonderful weekend. I know that's hard to say in the midst of COVID, but we do need to find ways of bringing joy to our lives in these times. Reach out to people in need. Thanks again. We're here for you at Tamarack. Every week we have a different webinar or two. We've got a weekly newsletter just focused on COVID-19, looking for positive stories of the community working together to help those in need. We just released an edition this week on poverty and how communities are supporting our most vulnerable. Again, Jim, thanks so much. Again, Alison, thank you. Thank you, Hannah. Thank you, Natasha, and everyone else in the background as these webinars are continuing. Thanks, everyone.
Thank you. Thank you very much,
Bye-bye.
Paul. Thanks, everybody.
Bye-bye.
Thanks, Jim. Thanks, Paul.